Hi guys, my name is Dr. Aleksandra Kopelovich and I'm a physical therapist here at Back to Health Physical Therapy. Today we're going to discuss 4 essential exercises after you sustain an ankle sprain. So let's get to it. So first we're going to talk about epidemiology of ankle sprain, how it happens, who it happens, and why it happens in the first place. I want to state that ankle sprain is one of the most common injuries in general. About 14% of all emergency room visits are associated with ankle sprain. As a matter of fact, about 70% of all ankle or foot-related injuries are associated with ankle sprains, which is a very, very high number, obviously. The thing with ankle sprains is that several studies have learned that there is a lack of people receiving care for ankle sprains in general, and there is a high rate of residual deficits following the ankle sprain, which includes ankle instability, some chondral or cartilage damage, and other significant medical findings. A recent CPR noted that if you sustained an ankle sprain, you're twice as likely to get another ankle sprain as well. That is because you lose your proprioception and balance components in your ankle because the ligament is damaged itself. Also, 20 to 40% of population that sustain an ankle sprain are more likely to develop a complex injury on top of that, which means you might sustain a cartilage damage, tendinomuscular junction damage, bone damage, and other medical complexity. So right now we're going to discuss the mechanism of injury of ankle sprains, and I'm going to invite my colleague to demonstrate that. Anastasia, please. Okay, so ankle sprain usually happens with plantar flexion and inversion injury. So the mechanism of injury of ankle sprain is plantar flexion and inversion, which means my colleague's going to demonstrate it right now. As she's stepping off, she's twisting her foot inwards. So plantar flexion means that you're pointing your foot down, and then you're twisting. Inversion means you're twisting it this way, and all the ligaments on this side actually sustain the damage. And right now we're going to look at anatomical structures that are actually involved. So right now I'm going to share the grading system with you guys, just so you know how to grade the sprain. So essentially there are a lot of different systems that grade it, but I'm just going to share one of them with you. So grade 1 sprain of the lateral ankle involves elongation of this ligament and this ligament right here. So elongation of anterior talofibular ligament and elongation of calcaneofibular ligament right here. Grade 2 involves a partial tear of anterior talofibular ligament and elongation or a stretch of the calcaneofibular ligament. And then grade 3 involves a tear of this one, a tear of this one, and elongation of this ligament in the back. So basically these two are gone, this one is gone as well, and then this one is there but it's partially torn. Okay, so it means that it's a lot of damage. So right now we're going to look at the rehabilitation process for that. So in order to know how to rehabilitate your ankle properly, you have to know what are the associated impairments with ankle sprain. So the first associated impairment is, of course, swelling and inflammation. That's something you're going to note around the lateral ankle joint. The second one is going to be instability. You're going to feel like it's unstable to standing on different various surfaces. Another thing is going to be range of motion. So you're not going to be able to flex and extend your ankle as you normally do. The next step is going to be the strength. Strength of various muscles around the ankle is also going to be impaired, secondary to pull on the tendon or possibly because of inflammatory processes within the joint. And lastly, proprioception and balance. And this is something that we're going to talk about today a little bit more in detail, and those are the exercises that we will show you right now. All right, so right now we're going to discuss the recovery for different grades of injury. So grade 1 injury, the expected recovery is about 5 to 7 days. And grade 3 injury, which is a complete tear, just like I showed on Anastasia, is about 31 to 55 days. So it's up to 2.5 months of recovery process. So right now I'm going to demonstrate some balance exercises. So don't forget, in initial stage of healing, in inflammatory stage, you want to look at PRICE, which is protect, rest, ice, elevate, and compress the ankle itself. And then essentially you want to start with range of motion, strengthening, and like I told you earlier, today we're going to focus on balance specifically. So there are various balance progressions that you can do. and Anastasia will demonstrate. So first you want to start on a flat surface with feet together. The next progression is going to be to a tandem stance where your foot is in front of the other foot and your heel touches the toe. And you want to hold this for about 30 seconds, and once you feel a little bit more stable, you can start progressing on to the next one. So the next one is going to be a single leg stance where Anastasia gets onto one leg and tries to maintain balance. What you can do to try to make it a little bit more challenging, you can, instead of keeping your knee completely straight, you can flex the knee, and it's going to give you extra instability. So you can take 3 of these different positions and take them to unstable surfaces. So you can take it to a foam pad or a Bosu ball. So Anastasia will demonstrate. So first you start with feet together, and then you're going to progress yourself to a tandem stance on a foam pad, and that's an uneven surface, so it challenges your ligament receptors or proprioceptors even more. And then you're going to go on to a single leg stance, just like so. Once again, you can flex your knee, and then your ankle is going to be a little bit more unsteady. And the same thing on the Bosu ball right here. So we're going to go feet together, and that's even more challenging. And then we can try tandem, but you can do half tandem where you don't have to go heel to toe. You can just go half of the foot forward. Make sure you're not falling, because this is a very challenging exercise. And lastly, you're going to go to a single leg stance. And make sure you flex your knee. Thank you. So another way you can progress them, you can stand right here. So I'm just going to show you on single leg on the flat surface. So the patient's going to stand single leg, flex knee. And then she can close her eyes, right? So closing your eyes gets rid of one of the visual inputs, and it challenges your balance even more. Then what you can do, you can open your eyes and you can wiggle your head side to side. You can move your head side to side, and that throws your vestibular system off and challenges your ankle even more. Furthermore, what you can do, you can close your eyes and start moving your head side to side. Okay, and Anastasia will demonstrate that.
No, Anastasia won't demonstrate.
Which you have to progress yourself to it, so you have to specifically train yourself for it. So another way you can challenge is to add an external component to the exercise. So here we're going to demonstrate it with a little ball right here. So she can actually stand on the foam pad, and she can get, let's do like a medium challenge where she's going to stand on it in a tandem stance. Let's do a tandem stance, or a single leg stance is fine too. Doesn't matter. And I'm just going to throw a ball from different angles to her, and she has to catch it. And you can throw at different speeds. You can do different level changes and challenge the patient that way. So I just want to summarize everything we talked about today. We talked about balance progression for patients with ankle sprains, and I showed you 4 different exercises of how to progress the patient with that balance. Of course, you have to seek medical care. Your outcomes will be much greater, and the succession rate of proper balance training, proper strengthening, range of motion is going to be way better if you see a medical care professional, obviously a physical therapist. And of course, don't forget to progress yourself to function. That's our #1 priority. We want the athlete, the patient, to return back to their functional skills. So you have to train according and specific to your functional goal, whether you're a runner, whether you're a volleyball player or a tennis player. You have to be able to train specific to your sport. And that is exactly what we do in physical therapy. So come visit us at Back to Health.